ran through a lot of misdiagnoses from the age of 15 on. They knew I had depression, but they didn't understand what else it was. I would have periods of blackouts. I would have periods of anxiety. Um, it was really tough. I often wouldn't remember things, and I was triggered quite badly. My diagnosis is dissociative identity disorder, and it came to fruition the most when my son of 7 years died. That's when everything got really bad. I thought of myself as a super mother, and it was something that I could do. Um, but I felt a lot of guilt after he passed. Once I understood my diagnosis and I was able to get the understanding and education and support, things started working into the recovery program really quickly. So I think it's really important to be educated about mental illness. Um, when I found NAMI is when I found the most strength, because I was able to slowly get education and support. You know, feeling suicidal, a lot of the people I work with are suicidal, um, and they have no hope. I remember what it was like to have no hope, you know, being in mental institutions. My 16th birthday was in a mental institution. I spent many months um, being locked up because they couldn't control my cutting behaviors or my self-mutilation behaviors. Um, so now, when I see someone cutting, I can help them because I know what that feeling is like. You have to kind of allow them to borrow your faith in them. And that's kind of what I tell people is that I have faith in you. Why don't you borrow some of my faith? And oftentimes you can reach somebody when you reach out to them like that. Sometimes it's, you know, I won't have a lot of confidence in myself, but I have confidence in the person that I'm helping that they can recover because I've recovered, you know, and that's really one of the most important things is being able to believe in the person that you're helping. 8 to 10 people a day that I'm reaching out to. Um, and of course, in crisis, it constantly changes. You have to be ready. Now, I haven't had a day in probably 3 months where I've sat and had nothing to do. So, but I know that you have to be able to go 0 to 60 in a minute's notice. You may be 1 minute talking to somebody on the phone, and the next minute in a rig going out to a person's house. And so you have to be able to make those changes and shift. And what I do is I put some of my triggers on hold to be able to reach out, because sometimes you can get triggered, you know, and accepting that trigger and then putting it aside is really important because you're not the main person right there. The thing that has helped me the most is when I was able to get a job, get private insurance, and get a trauma specialist. Unfortunately, with Medicaid, there's very little trauma therapy available, which is a shame because most of my recovery came after I started working. And seeing a trauma specialist has helped me to, you know, recover in very healthy ways. I think some of the most important resiliency skills that I have are being able to ground myself and be able to look. I was raised in a very dysfunctional household with a lot of physical and sexual abuse, and you had to learn how to survive. My resiliency skills have really taken me places that I never thought I could be because I've learned some of those survival skills, turning them into recovery skills. I do really some of the simple stuff, breathing is real important. Being able to ground yourself by taking a deep breath and feeling like you can feel the ground under your feet, or being able to name the five senses. You know, I hear this, I smell this, I taste this. I've been involved with NAMI for 15 years. And when I first came into NAMI's front doors, I was so lost. My son had been reported himself as having schizophrenia, and I didn't understand how to communicate with him. We were screaming at each other all the time. When I took the family-to-family class, I learned how to communicate and what was happening inside his brain. It wasn't a monster anymore. I was able to understand that people can and do recover. And that was the message that I got from NAMI, is that people can and do recover. And I think that's some of the most important message that I could give anybody.